So my typical day involves visiting people in the morning, generally to give medications. We also do things such as attend wound care if somebody's had surgery or fallen over and knocked their arm. And then we also see people for things like palliative care, so people that have been diagnosed with something like cancer, that they want to stay at home, and we go and care for them in their home. I really wanted to be in a profession in which I was able to help people and change their lives. My grandma was quite unwell and she was in hospital, and I went to visit her on several occasions and saw what the nurses did for her and how they cared for her, and that's when I made my decision to become a nurse. I applied for university as I wanted to be a registered nurse, and that degree involved 3 years of study in which we attended lectures, but we were also able to go on placement in the hospital and practice our skills and hands-on patient care. The most challenging part about being a nurse, I feel, is dealing with people with palliative diagnosis who are dying, and then often dealing with people passing away and interacting with the family and seeing how sad they are. That would be the hardest thing for me. What inspires me to be a nurse is the ability to change people's lives. Visiting people in the community, we see them in their own home, and just the way they react and how happy we can make them and how much we help them become well is what makes me want to do this job. To be a good nurse, I believe that you need to have empathy. You need to be able to put yourself in the position of your patients and feel what they are feeling. You also need to feel compassion and be compassionate about your job. Other skills that I believe you need to possess are you need to be organised, but you also need to be a really good problem solver. I love my job because it's flexible, rewarding, and you're changing people's lives.